and compare it to hundreds of other people. You're taking this metadata and correlating it to your genetic data and coming up with a makeup that's shareable. You don't need to put your name on it, but you can say, this is my genetic makeup from 23andMe. Yours has similar aspects to it. These are what I did to overcome these issues. Oh, I have those issues too. I'm going to point out to my healthcare professional that on here, and he can look it up on here and see that, wow, these procedures are effective for these issues, and we have a certain genetic makeup. And of course, they're the medical professionals. So that's going to be your primary source of information now. But we already have complex AIs that are not AIs, but
could start doing things with the data.
Well, they're already doing it in the US. So there are complex systems that are allowing you to put in your 23andMe information, and it's the Prometheus tool I was talking about, and saying, okay, you should look at these, and then when they show up, they start saying, oh, and by the way, check out these other things, because if you definitely have this, you should maybe also look into this.
So then what's another, with this doctors, what's going to entice doctors to go and sit in front of the computer and do this each day? Like, I guess there's doctors all over the world, and there's doctors in poor countries or even wealthy companies that would do this. But then I guess people who want to get more referrals would put more money up for their referral until it matches. Basically, I think where a doctor is earning more money doing this...
I think there's already I don't know if
this is kind of a breakaway system where a doctor doesn't have to be dependent on making money from a hospital or a
HMO or meeting insurance companies.
Now there's another way that they can make money.
Well, it's a true distributed autonomous organization where the members are clientele, the patients, and healthcare providers, the doctors. So they're making their contracts between themselves. Just as if we met in, on the plains of Toowoomba 50 years ago, and you're out there and you run into a doctor and you say, hey, you're a doctor, I've got this problem, I have the money, can you take a look at it? That's all you're asking for. You're asking for the best care they can provide in the moment, and we're just creating more links for more people.
Instead of having to go and get a Medicare number or go and get these different things. And then I guess...
Oh yeah, what's your insurance? You have Medicare, you have private. Oh, wait a second. Now, do you have copay or do you have bulk billing? Oh wait, it's not called bulk billing here because I'm a doctor in the US. I don't care about all that stuff. I will pay you for your time. Here's how I pay you. Yes, can you accept that payment?
And great. I just realized something else as well. These decentralized marketplaces will be where people can buy all the antibiotics and stuff. So they don't even have to worry about, the doctor can just send an anonymous doctor can send a link. So
absolutely.
Go to Open Bazaar, go and get these pills, this is what you need.
And you can track the pharmacology, right? So you can track the effectiveness of certain things. I have a son with epilepsy, I'm using this, the doctor switched me over to this. How many other parents had a son or daughter that had this issue? How effective was that thing? Should I go and get another opinion about going back on the old medicine, or is there something new that came out? And there are new and more effective delivery systems for drugs. There are new and more effective monitoring systems for diabetes. There are new and effective surgical procedures with new types of chemistry and architecture to solve problems that were extremely complex before, but are now becoming more of a commoditized procedure. There's enough people trained in it, but yet they're not all over the world. They're not ubiquitous. Not every doctor gets the same training and can keep up with the same information. This can be a place where doctors simply come in and look at what other doctors refer for certain procedures. They can see, oh, my patient needs... I can look for patients.
So doctors can learn from each other's records as well. So it's a giant learning environment.
Well, you can sign up, or the patients become a Wikipedia source, kind of metadata that they can now refer to see what procedures worked and what didn't. Not within some sort of closed system of medical journals, but people with health problems getting procedures that were solved because of certain diagnoses or recommended procedures.
So let's focus on, so thank you very much. We've got a really good summary of it, really, don't we?
Yeah.
So now,